For this skill, I got to do a postpartum assessment on a mother who had just given birth. We use the acronym Bubble HEAP on this, starting with the breast, uterus, bowel, bladder, lochia, which is going to be your drainage from the vagina after birth, the discharge. L, and then E, episiotomy. H, hemorrhoids. E is going to be your lower extremities and upper extremities. And then the last E is going to be for motion and bonding. So to start out, I would walk in, do hand hygiene, provide privacy, come up to the mother, and first then assess the breasts, ask her what her plans are for breastfeeding. You would assess the nipples for the color, whether there's any bruising, any cracks or anything. From then, you would assess the strength of the uterus, starting, you can start at the fundus and assess the rigidity. If the uterus is firm, you can leave it alone. If it is not firm, you massage it to make it a little bit more firm. For the next part, I need to make sure that the patient has used the bathroom, because we're going to be assessing their bladder and their bowels. So before assessing the bladder and bowels, I'm going to inspect the abdomen, looking for striae, looking for any contouring that might be off, and I'm going to go ahead and listen to the bowels in all four quadrants, making sure there's good bowel sounds in all of them. I would then ask about the patient's bowel habits since giving birth. Because of the medications that could be given during birth, they may have trouble using the bathroom, urinating, and also going to the bathroom. From there, uterus, bowel, bladder, lochia. So to assess for lochia, you're going to have the patient on their back. You would then roll them over, and you would assess the lochia on the pad that they're going to have, on the perineal pad they're going to have. You're going to assess the drainage. If it is enough drainage to fill up the whole pad within that day, you would be worried. If there's minimal drainage, there's going to be drainage, so you got to assess how much drainage on there. When you put the new pad on, you're going to make sure that you put it on from front to back to prevent contamination of the urethra. While you're over there, you need to assess if the patient had an episiotomy. You needed to look at the episiotomy incision, see how it looks. And while you're back there, you also need to assess whether the mother has hemorrhoids, whether they're visible, and what they look like, if they're bleeding or not. You need to make sure to put the perineal pad on, roll them over, back over. Then you can go ahead to assess their lower extremities. Because the patients are going to be in the bed for long periods of time, you need to feel in their calves to make sure that there's not a firmness, or that they have no pain in their calves. Mothers who are in bed for a long time are more risk for DVTs because of the blood flow issues. Assess their calves, and then you can go ahead and assess the edema in the feet. Make sure that there's no pitting in their feet on both sides. You can assess both sides. And then lastly, you're going to assess the mother's overall emotional well-being. Mothers who have just been given birth or at risk for postpartum depression. So you need to make sure to assess for that by asking them questions. After that, you need to go ahead and do your hand hygiene. You can make sure that the patient does not need anything else. Make sure they have their call light. You can provide for privacy, and then you can go document your findings in the chart.